radiation. But all light forms are radiation. Okay, whether it's infrared, ultraviolet, gamma, X-ray, those are all forms of electromagnetic light. But there's different ranges that have different effects. Homeopathy provides vital information to the body. Timing is a vital factor in healing. Body reflexes. Weird therapy is vital. Nutrition, vital to body healing. Diet, vital to stop the damage. Exercise, use it or lose it. Frequency therapy is the current frontier. Okay. What we do with cold laser therapy and a lot of other therapies we use, we have more chairs in this office. Sue?
There's one here.
Okay. Biomodulation is what we're doing with laser therapy. Yes.
Follow the path. Will I do that?
Yeah. Biomodulation is defined as changing the nature of the natural biochemical response of a cell or tissue within the normal range of function, stimulating the cell's innate metabolism, thereby allowing the cell to heal itself. And it's really the difference between pharmacologic and physiologic doses of care. All natural forms of care can be delivered in a physiologic or a pharmacologic dose of care. All allopathic forms of care are only delivered as a pharmacologic dose of care. By definition, a pharmacologic dose is toxic, and the method of determining if this is a pharmacologic dose is, a pharmacologic dose of any treatment will not only change the physiology or function of a diseased and injured tissue, it will also change the physiology or function of normal, healthy tissue. And there lies the problem in pharmacology. And that is what they're always trying to figure out, is how much change can we create in the body without killing it. Okay, every pharmacological, every medicine that you have has what they call an LD50. That means what dose do we give to a population where 50% of that population will die. Every single pharmacologic dose, every medicine you've ever taken, whether it's aspirin or some exotic drug, has a kill rate. And they try to keep that kill rate as low as possible. It's not zero, but as low as possible, to not kill people and still have beneficial effects. In this country alone, over 50,000 people a year die of bleeding, ulcers, and other type of problems from over-the-counter anti-inflammatories. The real safe stuff. 50,000 people a year die of that alone. In this country alone, and I remember when I heard this first, I remember one of the talk show hosts was just berating this chiropractor to be so ridiculous to even put forth the idea that 100,000 people a year die every year when they're given the proper medication, they're properly diagnosed, prescribed properly the amount that they're supposed to take, and it's delivered to them properly and they take it properly, and still 100,000 of those people or more die every year from medication. And that doesn't take into consideration those that are misdiagnosed, given the wrong medication, or they mix it with the wrong other kinds of medications, or they're misprescribed by the pharmacy or whatever. That's a whole other story, and that kills a whole lot more people. But just doing things the way it's supposed to be done, over 100,000 people die every year from that. And that isn't taken from some chiropractic journal. That's from the New England Journal of Medicine that posted that. Okay. So whenever you start on some safe drug, there's no such thing as a totally safe drug. They all have their side effects. Medicine shines when they're saving your life at the end game. Okay, that's where they shine. They can keep you alive long enough. Oops.
Yeah, you had a whole lot of food.
Okay, they can keep you long enough so that maybe we have a chance to help you in a more natural way. But they aren't very good at day-to-day type medicine. That's where I think we shine. Okay, so we have biomodulation, or we have pharmacology. Okay, a pharmacologic dose of any therapy is the dose necessary to produce and maintain the desired effect. The goal is to have a therapy stay above or at the threshold level for effective desired effects, but below the low toxic level, also known as try not to kill the patient. Okay. A pharmacologic dose always contains risk and will always do some harm to the body. Always. There's always some harm. It's just whether or not it's doing a small enough amount of harm that it's worth the benefit that you're getting out of it. This is very predictable. You know, almost anything they do is very predictable as to the micro, the actual effect that they're trying to produce. What isn't predictable is all the other effects that they're going to cause. A physiologic dose, on the other hand, is not toxic. And the method of determining if this is a physiologic dose is a physiologic dose of any treatment will only change the physiology or function of diseased and injured tissue. It will have no effect on the physiology or function of normal, healthy tissue. So, that is the beauty of the cold laser. We can treat you, and we can elicit a response and activate a response that is a normal physiologic response in your body without causing any abnormal side effect other than the normal physiologic response that your body has. Now, sometimes we look at some of these side effects as being, bad side effects of even natural remedies. Anybody ever tried to detox and had kind of diarrhea or some effect like that? That happens. But that is the effect the body wants to happen and needs to happen to get rid of toxins and things like that. And there's ways of doing it in a way that won't be too dramatic if you do it right. But they're not necessarily life-threatening, and they're not something that is really bad for the body. It's actually a good effect. It's just something that you may not like at the time. Okay? But that would be a physiologic dose. It's designed to stimulate production of or provide to the body what it needs to normalize and heal itself through biomodulation. A physiologized dose is generally safe and will do no harm. It generally improves the health. If you feel better, it is because you are better. And that's very different than drugs. I mean, you can feel better, and it can mask and hide things, but you're not actually better. Okay, we can probably skip through a lot of this. Where does light come from? Light's what God created probably first. Let there be light, there was light. All forms of matter are really light waves in motion. And there's all different kinds. And as I mentioned before, there's a lot of different kinds of lasers out there. Ours uses a visible light spectrum. That's like what you see, the colors of the rainbow. But ours uses the red portion, 635 nanometers, because that's the light frequency where all of the chemicals in the body that absorb light overlap in their absorptive phase. Okay, some of them absorb here, some of them absorb here, but they all are active in this 630 to 640 nanometer range. And so that's why we choose that particular frequency. It is a very low level light. It's 5 milliwatts. Very, very small dosage. So you're not going to cause any heat buildup in the body. That's the difference between this laser and many of the lasers. Dr. You mentioned some desktop models. A lot of those are infrared models. Okay, they use diodes. They're not. A lot of them aren't true lasers. They're LEDs, and they have some light amplification type properties. But they're not the same as this. And many of them are infrared. The red that you see is just some of the red they have there, so you can see where you're putting it. But the effect is from infrared lasers, and a lot of doctors use these because they work really good for pain. And if all you're looking for is pain relief, infrared can be really good, because what it does is it destroys very fine, small nerve fibers called type C fibers. They're very small and thin, and you can kill those before you kill almost any other cell. And so they go and they do what they call nerve ablation therapy by killing the cell with this infrared light, and you feel better. And then your pain nerves, those kind of nerves are fairly quick to rebuild, and they'll come back, and then you need another treatment. And I'm not absolutely totally against that kind of therapy. It's just not something I really want to be involved in. It's not healing. It's just kind of pain therapy, and there's lots of ways to do it. I'll let somebody else do that. When I take care of somebody's pain, I want it to be better. I want them to be less pain because they're feeling, because their body's healthier, and that's what we use with this laser. Okay. Just as kind of a short note on what laser is, this kind of puts it in line of why you can't just use a LED. This is regular light. It's all different frequencies of light. It's totally disorganized. An LED is monochromatic. That means it's one frequency of light. But see how they're not lined up? It's monochromatic but not coherent. Coherent means that it's all in phase and polarized. Okay, so that's what makes it penetrate the skin, and that's what makes it very effective. If we didn't have a property where the skin would reflect light off of us, we'd go out in the sun and we die. But our skin reflects the light off unless it's this kind of light, and then it can penetrate. Now you can penetrate deeper with a more powerful wattage. You can have 100 or 1,000 watts. And some doctor will say, well, yeah, he only has a 5 milliwatt. I've got a 100 milliwatt laser, and it's much more effective because it penetrates really deep. Well, that's kind of like saying, I have